So South Africa has reached the peak and in fact is on a downward trajectory in terms of this particular outbreak of Covid-19. The reality is that we're certainly well placed to go to level 1 immediately, but that doesn't mean that we can go back to pre-COVID type of lifestyles. And the specific restrictions which are extremely important to retain is the avoiding of mass gatherings in whatever form, because those are exactly the type of situations that lends itself to what we call super spreader events, which means that if there's one infectious person in that place, all of the people that are susceptible, that haven't been infected, all of them are at risk of becoming infected over a very short period of time, and then we're going to get an explosion of cases. So the number of people that have already been infected in South Africa, all indications are that it is a high percentage of people that have already been infected. It's very difficult for me to give you an exact number. Right? If you do a projection, if 1/3 of South Africa's population has been infected, that figure comes to about 20 million. Is it 20 million? Probably not. It might be less than that. For people to come into South Africa, there's very little reason not to allow for that to happen. And in fact, even when they come into South Africa, there's very little reason to keep them into quarantine. Unless they're symptomatic, having a few visitors come in with the virus, even if they're infected, is going to have a nominal effect in terms of the trajectory of this epidemic. It's not going to contribute to a resurgence. What's happened with this outbreak in South Africa is really, really puzzling. Insofar as, like I said, we've had many people that have been infected, much fewer numbers than we expected ended up with severe disease, and much fewer numbers than we expected actually died from COVID-19. And what's happened because of the reduction in terms of the transmission of the virus in South Africa, including in places where we're doing the vaccine study, the participants in the study are no longer getting infected as quickly as we had expected that they would get infected, especially if there was a lot of virus circulating. I'm fairly optimistic that at least for 1 or 2 of the vaccine studies that are currently underway, we probably will get an answer during the course of this year as to whether the vaccine is safe and whether it protects against COVID-19. Beyond that, it's an issue of gaining access to vaccines that are shown to work. And when we're going to gain access is a big, big question mark. As you're probably aware, countries such as the United States, United Kingdom, China to some extent, those countries have already been purchasing vaccines that don't even exist. So much of the vaccine that's going to be produced, especially vaccines that are going to be produced in high-income countries, the first few 100 million doses of vaccines, those doses are already bespoke for. There isn't any specific number that tells you that you're at herd immunity right now. And the difficulties that we have is that to some extent, based on information, studies that were done in the Western Cape, as well as some limited studies that have now been completed in Gauteng, we have found that between 30 to 40% of people in different communities, especially people coming from communities where there's a very high density in terms of the population, might have already been infected with the virus. Now, together with non-pharmaceutical interventions, when 30 to 40% of the community has been infected, you probably can get herd immunity. And that could be contributing to the reduction in terms of the transmission of the virus and why we're seeing a downward trajectory. So in the absence of non-pharmaceutical interventions, we probably require about 2/3 of the population to have developed immunity against COVID-19 before you have this interruption in terms of the chain of transmission of the virus, and we're not there yet. What will probably happen in South Africa, in my opinion, is that we probably will start seeing a resurgence in terms of spread of the virus, probably end of January, beginning of February. And the reason for that is I expect that unfortunately people are going to become more complacent during the vacation period, during the December period. Reinfection with SARS-CoV-2 has been documented in a few cases. This, however, is not surprising, as it is common with many other respiratory viruses. The main issue is one of that reinfections are most likely going to be less severe and in most instances either asymptomatic or result in only mild illness. In addition to which, the reinfection will probably result in that person being less infectious than the first time around. Probably the most important learning lesson should be that you can't wait for a pandemic before you try to correct the deficiencies in your healthcare system. Had our healthcare systems been adequately equipped, which it should have been, and both in the public as well as the private sector, not just the public sector, it involves both the private as well as the public sector, we wouldn't have to go into a 5-week level 5 lockdown to buy time to better equip our healthcare facilities. The amount of money that has cost the economy is money that could have been better invested in the previous years to ensure that we had a resilient healthcare system that would be able to cope, at least to some level, with the pandemic that we're experiencing currently.